Well, 13 mine workers in one of Limpopo's mines have tested positive for COVID-19. The Provincial Health Department is currently, as you can see, hosting a media briefing. Let's go there now live.
When there are issues that arise, call you and update you. So last night we received the results confirming that 13 mine workers at Marula Platinum Mine around Beggarsford from Sekhukhune district in the Greater Tobatse municipality have tested positive for COVID-19. This is by far the single biggest number of positive within 24 hours that we have received, and also from one establishment within 24 hours. We have also recorded 2 new cases from Lephalale, bringing the total number of the 24-hour cases received to 15, and then adding to our previous cases that we had, the total cumulative cases in the province are 76. To date, our number of active cases stands at 36, with 37 recoveries, and of course, unfortunately, 3 deaths. These numbers of positives come from the 9,690 tests that have been conducted in the province, of which 5,121 comes from the public facilities and 2,561 comes from the private laboratories. The MEC and the HOD, we have held several virtual meetings since last night with the mine managers of the same mine, and of course up until now we have just come out from another meeting for us to try to establish the facts and also to come up with a solution and a way forward to try to curb the spread within that area. A response team from the Department of Health, we must reassure you, there has been on site since last night, working together with the mine staff to make sure we assist in terms of the isolation of the 13 that have tested positive, and also tracing all the contacts, because these are people who are not residing within the mine itself. Of course, we did anticipated that the relaxation of the lockdown regulations, rules in order to open some economic activities will bring many challenges insofar as increases in the number of positives is concerned. It is for this reason that immediately after the announcement of the opening of the mines, as a department, you'll remember that we made a clarion call to all our mine bosses to say, let's work together and take extreme precautionary measures to prevent the spread. Key amongst our recommendations was that upon return to work, workers must be screened. Those who meet the criteria for testing, they must be tested, and also quarantine all those who are coming from outside the province. It has to be done before you can take any mine worker underground. And this we were doing, and we're making this plea and this call guided by our understanding that the mining environment is fragile and it's a high risk and susceptible to transmission. This is a point that we want to continuously to repeat, to say we are welcoming the fact that at some stage economic activities must start to happen, and the mines in this province are one of the area that is very key in terms of our economic development. So we are expecting them to start to function, but we are saying for us to balance, because the lives of our people it's also critical and important. We need to find a way how we are going to balance the two, to say we then open our economic activity, but at the same time protecting more especially the vulnerables. Because in our discussions with the mines, we are saying to all mine, we need the profile of all their employees, those who are above 60, those who have got other comorbidities, those who are vulnerable, so that we can be able to focus on them. Those who are not really vulnerable, they will form part of the statistics of the positives, but they will also form part of statistics of the recoveries. But those who are vulnerable, unfortunately, they are not just going to form part of the statistics of positive, they are going to die, and we are going to lose them. So that is where our focus now and our energy as a department, working with all these sectors, must be. We cannot stop the inevitable. The numbers are going to go high, but the problem is who gets infected at this point in time. So what we can indicate that we have been able to establish, working together with the mine managers, is that following the President's announcement to relax the regulation, the Marula Platinum mine was proactive, and they then invited all their 3,300 employees through SMS and emails to report on duty. Their focus was those who are residing within that area. 2,700 who reside within that area or within the province responded between the 17th and the 20th of April. And during that time, that's when the mass screening and testing within the Marula Platinum mine happened. And amongst all the 2,700, there were those who were referred for testing, and specimens were collected, and they came, we must put it on record, they all came negative. This was immediately after we had done our own mass screening and testing as a department. The mine still, between the 17th and the 20th, they did the very same activity that we did, and it was able to yield similar results that we did as a department. Of course, further on the 6th of May, if I'm not mistaken, the 6th of May, 130 employees reported to the mine, and upon arrival, there were no clear answers as to where they are coming from. But of course, from where we are sitting as a department, it's clear that these are not necessarily the people who were within the province during that time, because they would have reported during that time. This could be people who have been away, people when the lockdown, they left and they came back. So the mine decided again to be proactive, to say we can't let them go underground. We have already screened the ones that are underground and tested, the ones that have been accepted in the mine. These ones, before we accept them to the mine, we must take them for screening and testing. And that exercise is the one that has yesterday given us the 13 have tested positive. We have not received the full results of the 130. So we must still expect more. Because for us, there could be a lot of stories that it's water under the bridge. These are people who remember case number 6 in Skukune. Case number 6 in Skukune. It's a contract worker within the very same mine, but contracted. They come from Eastern Cape. They came through Ekumbi, that side, and they were tested. This one who was symptomatic tested positive, and they are residing within the very same area around the community. So when we say, when you come from outside the province, don't rely on your test results. When you come from an area which is infected, rely on quarantine. Results, they are good to have, but they are not a guarantee that you are COVID-19 free. If you would learn from the exercise that we had after our own brothers and sisters were repatriated from Wuhan, they were all negative, but we still quarantine them for 14 days, because that's the only way you will be reassured that somebody is negative. If you have not been for 14 days given that observation, because two things happens during the 14 days. You either shows your symptoms that indeed you've got COVID-19, or you either fight the virus off and after 14 days you are clean. Because what is important for us is to say you should not infect the others. It's not only the number, because the problem when you infect others, we don't know who are you going to infect. So we are also comforted by the fact that the Premier's task team that is working with the mines, the Premier has already given summons for us to meet tomorrow morning with all the mining bosses so that we can learn from this particular case what has happened, and then moving forward all the other mines in the province, because we are still having other mines in the province which we need to learn from what has happened in this particular mine and take notes and see how can we strengthen our fight for COVID-19. We cannot prevent the people from getting positive. They are still going to get positive in the mines, but we must prevent that the vulnerable must not get positive. So through this meeting, we believe that a very clear way forward on how government and mines will work as we continue to protect the vulnerables will be. We are again once more calling upon our community members to continue respect the laws of lockdown and also continue to practice and take precautionary measures. Let's remember to wash our hands with soap and water. Let's wear a mask whenever we go out to the public space, and let's observe social distancing. Thank you very much, Ndonibu. Baya danki na cancer. Ra lebo, le ga di sa lebui.
Sean, we're going to quickly take a round of questions for clarity. Let me observe a round of hands. You know the card will just tell us who we are, where you're coming from, and then the question. Then let us decide the money, Titus, and I can't see you clearly. Now with the mask, you will follow, and then the Cosmo will be the first in the front.
Okay. MEC Demand Barlow from SABC Radio News. MEC, would it not be better for the mines to shut down then if you're saying you are aware that there's going to be infections in mines because of the confinement of the area they work in? Is government considering getting into communication with mining companies so that they, even if it's temporarily until they get the situation under control, what are the discussions that are being held between mining houses that are operating specifically in this province and government in the province? Thank you.
Yeah.
All right, thank you very much. Titus from Capricorn FM. MEC, you said the Marula mine has recorded the highest number within 24 hours in terms of the COVID-19 cases. In that sense, will operations resume at that mine, given that the number of infected people is large? And in terms of the precautionary measures, are they effective? Because, and I remember the Minister of DMR said before the mines can resume, they should ensure that those screening and testing measures are put in place. So, are you confident that these measures are effective? Because now we are rather experiencing more cases than it were before.
Yeah, that question.
Russell from News 24. Mine is just a clarity, man. Between the 2,700 that you mentioned and the 130, may you please just clarify what happened? What is the 2,700 when they returned and the 130?
Mashudi Sadiq, Media 24. Just to understand, MEC, with all the 13 mine workers that had tested positive, where were they living? Were they living
on the what? 13?
The 13 mine workers that had tested positive. Where were they living? Were they going back home to their families every day, or were they living on site at the and if these people are being traced, ones that they could have affected if they're going back home?
Thank you very much. Pimani, will it not be better for the mine to shut down? I think most of your questions are related. What are the discussions? Marula recorded the highest. Will they continue? It's almost the similar questions. It means the precautionary measures are not, Titus, are not effective. and okay, the clarity from Russell's. They are all related, so I will be responding to all of them at the same time. What we want to, let's get to understand. The mine has got the staff establishment of 3,300 employees. They have issued the SMSs around the 15th of April that respond on duty, all of you, for screening and testing prior the assumption of duty. 2,700 who are locals responded for that screening and testing. There's still a difference because others they're saying are from even outside the country who did not, which they expected. 130 responded. This 130 did not respond. The 2,700 that responded, they were the ones who were screened and tested and were cleared up, and they were taken underground because they were clean. Now, the 130, they were never screened, they were never tested. We don't know where they were. There were many reasons that were provided why they did not respond according to each employee, which I think we can't necessarily as a department get into. That is for the mine to deal with. But what the mine did was to say, we will not allow you until we know your status. Even those who were not having any symptom or any sign, they did not use the guideline that we are using of saying someone with a cough, whatever, must go for testing. They test all of them. So during the test, that's when these results are coming. So shutting down the mine, yes, the mine is not in operation now. But what we must remember is that these people who are tested positive were not necessarily in the mine. So you can't say the mine here has not complied. This is one of the mine which we have been working closely with in terms of guidance. They would seek guidance from us to say, what can we do when the situation is like this? So they could have allowed the 130 to go into the mine and start working, and they would have infected the 2.7. So they did not allow the 130. They said, we need to test you. The only problem that we are having as a department, which we are guiding, and that's where we think we are failing to find each other, it's on the forceful quarantine. That's where we are not. They think by testing is the one that you will cap the spread. And we are saying that testing depends on the timing. Today I can test negative, but being positive and being infectious, it doesn't assist. But the quarantine, as I'm saying, why don't we use the very same example of the Wuhan case? They were all tested before they left China. But we said, because they've been in an area which had COVID-19, let's quarantine them again at the range for 14. Even when they arrived, we tested all of them. Remember on Sunday, they all tested negative. But we didn't say go home. We said we still need to observe you for another 14 days in case you might have been infected at the airport. We don't know. And we did that. And it's possible that somebody might have been infected, but that 14 days might have had assisted us to clean up. So this is where we are saying with the mines, let's invest on quarantine our workers. The testing and the screening must not go alone. As long as you know that one has been exposed, we just need to also indicate that besides this 13, in the numbers that we had previously, there is a doctor there who has been screening especially the contract workers and the staff who has also tested positive from that area, and also the staff that is working with that doctor in their clinic. They have already tested positive. We had already counted about them. So it's all about the problem here is not within the mine. The problem is also, it then answer one of the questions we say, where do they reside? They are not residing within the mine. They are also residing they have not stayed in the mine. If you were saying they are residing with the mine, they've tested positive, then would say there's a disaster now. These are the people who are coming from outside and say we are reporting on duty today. Then the mine says we must take you for testing. And then the system was able to pick them up. So in that case, remember our meeting tomorrow, it's with DMR also, where we are expecting Mineral and Energy to guide us on this particular issue. But our advice is that quarantine everyone, you'll be safe. And also if mines want in Limpopo, our advice would be to say, we want your mines to operate. Why don't you create your own the range and have your mine workers have their temporary shelter, stay within the mine, work in the mine, produce whatever minerals in the mine, and that's it until we know the curve has been flattened. This is our advice. Then you are safe. But when you still let them go out, come in the evening, out and in, you are still, even if you have done your screening and your testing on day 1, after day 3, they would be infected because they will still be interacting with the community. But if you have quarantined everyone there, you are safe.
Follow-up. Okay, we'll give you the privilege for follow-up. You got a follow-up as well?
Yeah.
Okay, as well? Yeah. Honestly, they're saying you did not respond to that.
Okay.
Okay, let me give you a chance for follow-up. Then afterwards we'll take that first question, the fresh question in that order.
A follow-up question, MEC. Isn't, like you are saying, is it not a requirement that government has put in place that for a company to go back into operation, they should provide quarantine facilities for their employees? Can a mining company decide that we've tested you, you are positive, you'll see what happens where you go if you get into contact with other people and things like that? Does government require companies that are operating right now to provide facilities for people to isolate in when, even before they're tested or after they've been tested positive or not? What is government doing to ensure that companies take responsibility of ensuring that employees that are specifically found to be positive, do not go back into society?
The Mineral and Energy guidelines, Bimani, to them, it says you must test, and when they test positive, then you must provide quarantine and isolation facility when you have tested positive. But my argument from a clinician point of view, let me not be a politician for once. When you test positive, it depends on the timing of your test. If you test on day 7, from day 4 to day 7, chances of you to get the true reflection of your results are very high. But you test before day 4 to day 1 of getting contact with and be infected, chances are you will give the false results. Now, when you test me after day 3 of being in contact with a virus, let's say I get infected, you test me on day 3, because it's a requirement to test me. You test me on day 3, I'll give you what? Negative results. When I give you negative results, you allow me into the system. What am I going to do? Infect everyone. So hence I keep on reminding people to say, maybe in Limpopo, the problem was the national government gave us a responsibility to quarantine people whom we knew were COVID-19 negative. If you remember when people were saying you are allowing a coronavirus to the province, and we kept on saying the people have already been tested and they are negative. But that system has made us to learn how to deal with this virus. And I can tell you, even when we were dealt with to say, why do you forcefully isolate the doctors in MDR, we were saying, this is the only way you can curb the spread. If you then isolate people who are not complying, they must be isolated. And this thing of self-isolation, we've seen it doesn't work. It's not working, Piman. So you then isolate people. That's why we've been able to keep the numbers. So mine will say, we will quarantine. We are not refusing MEC, but we'll quarantine those who are positive. And who are those who are positive? It's those who, one, would come and present with a symptom. How many present with a symptom? Very few are presenting with symptoms. That's the first thing, indication for testing. Secondly, we will only quarantine those who test positive after presenting with a symptom. So how many will test positive? Not everybody will test positive. So this is where there's a gap to say, we are saying from our side, quarantine everyone. Because you don't know who is infected and who is not. Because the current test and the current screening will not give you the 100% results that you want. That is a fact. It's there. You can't run away from it.
Okay, with regards to your forecast on the number of cases that we might record, given the tracking and tracing, measures, do you think we, as a province, we really need to a transition from level 4 to level 3?
Take all of them.
Okay,
Yeah, because this is a new question.
Yeah, you partly answered my previous question. But what is the process, MEC, after a person gets tested positive? In the case of these minors, they tested positive. Are their families being traced? Are their families being traced, and everybody, including everybody that has been in contact with them, and are they going to be quarantined, or they have to self-isolate?
Let's okay. This was Professor for the question.
Thank you. My name is Jimmy Matram from SABC News in Polokwane. MEC, in Free State, the source was a church service. In the Eastern Cape, the source was a funeral. Those are patterns of cluster breaking.
Yeah.
My question is, the last cases in our provincial states, 15 or 20 of them are from the mines. So are the mines becoming a cluster breaking source in the province? If that is the case, what is the health department's, national or provincial, what is the health department's approach in dealing with cluster breaking or bushfires? In this case, it's a mine, or if it's a factory. How do we deal with different kinds of cluster breakings?
Thank you, Mr. Natro.
Thanks very much. Pimani, I've already responded. Mashudu, the process. When you test positive, irrespective of where you are, immediately, of course, the process is, once you are a suspect, we ask you to quarantine while we are doing the test or while you're waiting for your results. The moment they collect, if any of you has been tested and you are here, you are breaking the law. Once we collect your swab, you must quarantine yourself. Stay away from others. When you test positive, we then isolate you. You stay away from others. It's still the same, we're just changing the language. We isolate you. It's just that now when you have tested positive, when we isolate you, we are now starting to observe your symptoms so that you don't get sick. We give close monitoring on you. You are already confirmed that you've got a virus now. We want to see if the virus will do the damage to your body or you will fight the virus. Now, when the virus does damage to your body, we then move you out to our other hospital isolation, which is in Petersburg. We'll take you from Mudimule to Petersburg. When you are in Petersburg, you are in isolation ward, where you are strictly seen there by the doctor on a daily basis. If you complicate, you get to be severe, you need supportive ventilation, we'll take you to ICU. That's the process until you are either going to recover to be discharged, or until, unfortunately, we might lose you. So that's the process when you get infected. So with this particular mine workers, as I've indicated in our statement, immediately when we get the results, we contact each and every one of them. With the mines, the agreement is to say all of them must be isolated by the mine, because we don't trust the self-isolation. Indeed, our officials, when they found where these mine workers are staying, that's what is causing the cluster outbreak. It's because of where the environment they are staying. The social distancing cannot necessarily be practiced. And we've been saying that regarding our mines, to say that we know is going to happen. Because we've learned even with the TB infection when it comes to mining area, it's almost the same situation like what we are observing now. So I hope you're answered. So now all those mine workers, as I speak, they are in isolation facility, not self-isolation, but isolation, working together with the state and the mine we've provided. They will be monitored closely by our officials, health officials, together with the mines up until there are 14 days where we'll repeat the test and then be able to discharge them. The conditions that I was given this morning by our chief director at the district, they are all in a stable, they are asymptomatic basically. So meaning we don't have a lot to worry about. We just need to remove them from infecting others. Now what the team has been doing since morning is to get their families, their close contacts, whom we are currently testing them within that particular area. So I'm sure I'm also partly answering Jim. We are now testing everyone. We have zoomed in the entire area where they are residing. And the team is there. We've beefed up the Sekhukhune team. When you don't see my HOD here, it's because she's there with doing supervising that particular work, so that we get into every single contact of these particular mine workers. And even those ones who have tested negative, we have said don't only focus on these ones, because even those who have tested negative, you don't know whether they are negative. They might be spreading. So the issue is, if possible, we are looking for a venue. There will be, because municipality must also come on board, provide us with all those quarantine facility, and quarantine that whole population within that area. Those who are positive will clear themselves when they are within that quarantine period, and then when they come out, we don't know whether you develop immunity on this virus, meaning they will be safe afterwards. But what is more critical, it's for us to be following up on the vulnerables, where we said to the mines, we need your profile of all your work force, who is above 60, who has got comorbidity, so that we start closely monitoring those ones. We don't want them on site. We want them to be in a protected environment, because the problem is that we don't want that situation, that stage where I said you'll be in the hospital now, you'll be in ICU, and I'm assigned the death certificate. That's what we don't want to see happening. So that's what we are doing. In terms of the source, you're quite right. When we were level 5, when the president made pronouncement to say we will be relaxing, as a province, we presented also to the national that mines in our province becomes a risk. And there were times where we said Sekhukhune, it's 0 in terms of the number of cases, because the mines are not operational, where we know there's a lot of interprovincial and inter-continent movement and inter-sub-regional movement. We have made that call to say we see our mines as one of the area that we cannot survive without in terms of economic activities. But at the same time, from a health perspective, we see the mines as a high risk in terms of transmission of this virus. We are then requesting that we be allowed to develop our own guidelines, which will be suitable, which we feel will work. Hence, when we made that call, if you remember, we were told that you cannot run your own state. But the fact of the matter is, sometimes as a province, we look at the material conditions on the ground and we make certain pronouncements. That's why you had us even this to say, once we move to level 4, we are expecting mining activities to happen. And people who are working in our mines are not necessarily people coming from the province. We might have screened everyone and tested everyone. People are still going to come from other provinces and other areas, not even knowing themselves that they are positive, because they are fine and they are healthy, and they don't know that they are continuously spreading the virus. So that's exactly what has happened, and that's exactly what we are currently dealing with. So we have moved into that area. It's not only this particular mine. So what then did we do as a province? We then, the Premier, established a team, because firstly we had a meeting led by the Premier as a chairperson of the Command Council with all the mining bosses, and we were allowed to advise, this is how we think mines must operate if they want to see themselves operational. We have been hard on the Mineral Council, said this is the way to go. Even tomorrow we are going to meet them again and really emphasize, because we still have got other mines. We are also on Monday meeting Venetia Mine, because they also want us to clarify them. What do we mean? So hence we are saying this could be our area of start learning. So say, let's see what has happened in this particular mine. We could have been saying the West. Imagine had the 130 be allowed into without testing them. They could have infected the entire 2,700. That's simple to infect in the mine. Could simple social distance. It's not easy to practice it. You can't practice it underground. I've never been a rock driller, but I don't think you can practice it underground. When I speak to my comrades in NUM, it's not going to be practical to practice it there. So you will be forced to shut down the very same mine. So while our argument is to say, while we want them to work, but at the same time, you might end up not working. If we don't become cooperative to each other, we might end up not working. We might just cooperate with each other and find a common ground to say, we want to work, but also we want to protect our people. And what is more critical is that the lives of our people comes first. That the health of our nation doesn't matter. The health must come first. And we must prioritize them, because the very same people you want them to work for you must be healthy. If they are not healthy, they are not going to work. So that understanding, if it's there, we will be able to look and work together. So for me, all those teams, they've been put in place in the province. And you will see, and also the visiting of this mine, it's continuing. Remember, even the very same mine, we went to visit them prior, and they've taken us through what they are doing, and that's when they even started to test. We have also visited Fosco mine in Bapalaburo. We will be going to Tabazimbi. We'll also be going to Mohalakwen. So these are the premier's visits to be able to provide that leadership, because we've seen that the mine, for us, to be honest with you, if you look at areas which do not have the mining area, I want to agree fully with you. Our cases, look at Vembe. The last time we had 6 cases, they've been stagnant at that 6. They've never had any new case, because Venetia mine probably has not started. So we need to prepare. If they start without following our advice, we're going to sit in the similar problem. Mopani district still sitting at those cases. They've recovered 4 cases. We're not seeing that. Even Capricorn, which is supposed to be busy, you will have 1 case in a day and another after 3 or a week. You see, Capricorn was supposed to be, but we are not having that. But when you look at Waterberg district and Skukun, these are our mining areas. You look at Lipalale, you look at Mukalakwena, look at Tabazim. This is where all our new cases are coming from. So, and this is exactly what we said when we relaxed to level 4. We said we're going to have new cases. Our cases will not come from a church, nor will they come from a funeral, nor will they come from correctional services. Because in those areas, we have done our work and prepare. But our cases will come from the mines. And that's exactly what we are currently experiencing now.
Thank you, Mr. Colleagues look satisfied. And on that note,
just one more. MS, do you have the collective number of the people who tested positive in all the mines?
We can get you that exact information, because remember, when I'm telling you that 13 mine workers, I still have a doctor whom I did not count as a mine worker, but she is also a mine worker because she was looking after the mine workers. We also have a nurse within that. So we will have to give you to say, these are health professionals within the mine itself who contacted the virus, working with patients within the mine. These are the, can you allow us to do that and give you the exact numbers and also each mine as to which and where.
And the transition from level 4 to level 3, what's your position as a province?
Or as a province, we're saying, as we have indicated, we just need to deal with the current areas that are seen as the hotspots. We never had a hotspot previously. Our hotspot is the mines. Now we need to put our focus on the mines, but we can't really stop moving from level 4 to level 3 when the time comes. For now, it's not yet the time. For now, we are still on level 4, and for now, allow us to implement the level 4 regulations as pronounced by the president. The issue of level 3 will come if people can be able to comply with level 4. Currently, people are not complying with level 4. And honestly speaking, let's start to emphasize. And until, you see, when we say we flatten the curve, for me, I look at where is my challenge area. My cluster area is the mine. Have I flattened the curve? No. Actually, the mine has come and taken over. The total number of cases, now Sekhukhune, which was at 0, is now number 1. All the cases in Sekhukhune, except the death, who traveled all the way from Cape Town to here, to Tuvatsi, and died in the surgery of a doctor. From that case, from case number 2 in Sekhukhune to today's case is number 122, all the cases are in the mine. So there is no case that you will say you have picked up from the community. Yes, Sekhukhune. You are getting them in Greater Tuvatsi related to the mines. So that is where I can make a conclusion that the mine cluster outbreak as a province is the mine. And if we don't deal with them now, tomorrow we will be in Exaro in Lipalal. We'll be in XCOM in Lipalal. We will be Midupi there. We will be where? In Venetia mine. You see, we've got so many mines in the province. So allow us, Titus, to deal with this level 4 and also find a way. Once we are really satisfied in our mining areas, we know as a province we'll be able to do well. In other areas we have been there, we have seen a lot of compliance and a lot of work being done. The mine, it's exacerbated by the fact that it's not only our people who are working in our mine, and we can't control that. We are not a federal state, we are a unitary state. Let me repeat what I've been warned about.
thank you, thank you, colleagues. We always appreciate that.
You're fine.
All right, you are listening to a media briefing by the Limpopo Health MEC, Dr. Phophi RAMATHUBA. They're talking to us, updating the media on these 13 mine workers that have tested positive for COVID-19 in a single mine in Limpopo. So basically what she was talking about, a lot has been said, and so let's digest it together. She was talking about 2,700 employees who reported for screening and testing. Now on the 6th of May, around about the 6th of May, she was saying that about 130 employees reported for duty at the mine. They could have been coming from outside of the province. And she said, so the mine then decided to test these 130 people, and it was then that they found that 13 people have tested positive for COVID-19. There is going to be a meeting that will be held soon between the government and mine bosses to chart a way forward in how government and mine bosses, or mines in general in the province, can work together in order to stem the spread of COVID-19. So that, in a nutshell, was what the briefing was all about. So far, Limpopo recording 3 fatalities due to COVID-19 related complications.